Welcome to the City Club's Friday Forum. I'm Sam Metz. I and my colleague on the Friday Forum Committee, Nikki Noack, are the producers of today's program. For more than a century, the City Club has been where civic-minded people come together to find solutions to our region's biggest problems. We are gathered today at the Sentinel Hotel in scenic downtown Portland. We're joined by thousands of people via our media connections. It's X-Ray FM at radio stations 107.1 and 91.1, KGW's website, its Facebook feed, and its news app, and Open Signal's community media stations. We are grateful for all the work they do to bring our Friday Forum to the community. In addition to the City Club's valued media partners, staff, and volunteers that enable us to put on Oregon's best civic programs week after week, I'd like to thank AARP Oregon, Avangrid Renewables, and SEIU 49 for their generous support of this program and all of this fall's Friday Forums programs. This program today will not be a debate. We will highlight the consequences of the passage of Measure 106 and to discuss how it affects people in Oregon. Measure 106 proposes an amendment to the Oregon Constitution that would prohibit state funding of abortion. This amendment would prevent women who depend upon the state of Oregon for their health care or their paycheck from receiving an abortion regardless of incest or rape. Future legislatures cannot overturn this prohibition because this is an amendment to the Constitution. We're going to hear more about the City Club's research on this. First, I'd like to introduce to you our very distinguished panel of guests who will give their reasons why Measure 106 is bad for Oregon. First, our moderator and panelist, Kalpana Krishnamurthi, there on the far, your left. She is the National Field and Policy Director of Forward Together in Portland, and has previously directed the Racial Justice and Gender Justice programs at Western States Center. Next to her in the middle is Dr. Sharon Myron. She is a Multnomah County Commissioner. She's here as a private citizen. She is an emergency medicine physician. She has also served as medical director for the Oregon Foundation for Reproductive Health, working on reproductive justice issues, including the One Key Question Pregnancy Intention Screening Initiative. And lastly, our third guest, Jeffrey Hans, is from another planet. He is from the South Texas chapter of Planned Parenthood. His organization provides care to women in some of the neediest parts of the United States, in a state that is perhaps most besieged by assaults on reproductive rights. Before we get to our panel, however, I'd like to invite Sean Fleck of our advocacy board, who will discuss the City Club resolution opposing Measure 106. He is the author of that resolution. Sean.
Nyaku Sitne Sean Fleek na Isitina Inono Ayanainu. My name is Sean Fleek. I'm a descendant of the Northern Arapaho tribe. I'm very honored to be here. I'm also very honored to work with City Club. There's a long history at City Club of work on this issue. In 2014, City Club examined Initiative Petition 6, which sought to prohibit public funding to pay for abortion. A similar statewide measure to Measure 106 also failed at Oregon's ballot in 1978. As Sam mentioned, today's Measure 106 proposes an amendment to the Oregon Constitution to ban the use of public dollars for abortion. This prohibition could not be reversed by the legislature. The Research Board and Board of Governors reviewed the previous research and the current ballot measure and concluded that the substance of those reports also applies to the question of Measure 106. Oregonians have many times rejected attempts to limit abortion access in the state, and City Club's Board of Governors recommends we uphold that legacy. This resolution calls for a no vote on Measure 106. In previous reports dating back as far as 1978 and in the current resolution, City Club found that limiting access to abortion is damaging to lower-income women and women of color. A few important facts to consider. 271,833 women of reproductive age receive health care through the Oregon Health Plan. Under Measure 106, these Oregonians will lack access to the full range of reproductive care. Public employees would also see similar changes to their health coverage since their health care is funded by public dollars. CBS News reported in 2017 that most Americans cannot afford an unexpected $500 expense without going into debt. This is approximately the cost of an early-stage abortion. In August, City Club members voted overwhelmingly to adopt the resolution and to take an advocacy position on Measure 106. Thank you to my fellow City Club members for supporting independent research and for upholding the autonomy, dignity, and privacy of women in Oregon to make their own healthcare decisions. It is my great honor to please turn over the stage to the people who should be speaking on this issue, women, and the people who defend them. Kalpana Krishnamurthi.
Okay, so let's just do some level setting, right? We are 11 days from the election. Some of you, I know this table right here has been knocking on doors. I know there's tables all across this audience that have been knocking on doors. So I can see you literally vibrating in your seats. And I so appreciate that you came here today to spend an hour talking, thinking, and focusing on abortion access and Measure 106. This is a critical fight, one of many in our state, and we're excited and honored to have two incredibly rich speakers with us today. So as Sean and Sam said, Measure 106 would eliminate access to abortion for an estimated 1 in 4 Oregonians who are on the Oregon Health Plan. It would also eliminate access for public employees like nurses, teachers, firefighters, and their families. And you know, it's funny, in preparing for this, I kept going back and forth with Commissioner Myron or Dr. Myron. We're gonna kind of go with Sharon, which feels a little awkward for someone who is fancy, but that's what we're gonna do. So, wearing whichever hat you'd like, Sharon, can you tell me what you think about this? I mean, I want you to wear kind of both hats, right? As an ER doc, as a healthcare provider, but also as someone who understands healthcare from the provider perspective at Multnomah County, which provides healthcare to 200,000 people in the county that get their healthcare through the Oregon Health Plan. So I'm just curious about your initial reaction to Measure 106 as a proposal.
Well, I will first answer that in wearing my hat as an emergency physician. You know, in medicine, we talk a lot about shared decision-making, and that is where we make decisions with our patients based on their own individual life circumstances and based on the medical evidence. That's what we should be doing, and oftentimes when we, you know, talking to women, talking about the circumstances surrounding the decisions that we're making, and making those difficult decisions, it's really challenging as a provider and as a patient. And the last thing that we want to do is have you know, an insurance question injected into that conversation. So it really just inhibits the relationship and inhibits the decision-making process for women and for the providers who are attempting to help them with those decisions.
Right, because in Oregon, abortion coverage is mandated in private insurance programs. So if we now are creating a situation where 3 in 4 Oregon women have access through their private plan, but 1 in 4 doesn't, it really is an interesting dynamic as a provider to say, well, okay, wait, how do you plan to pay for this procedure?
That's exactly right. And I mean, basically what it does, it enshrines in our Constitution basically categories, 2 new categories of have and have-nots in our healthcare system, which is just ludicrous to think about that from a policy perspective, from a human perspective, and and this has been something, having this right to the full spectrum of reproductive healthcare coverage has been in our Constitution, has been in our publicly funded and private insurance for almost 4 decades. And to suddenly take that away from a certain group of people who have had that access creates this blatantly unfair system.
Jeffrey, as I was preparing for this, people were like, this cool, why are you bringing up a guy from Texas? And, I kept saying, well, in a lot of ways, Texas is like the canary in the coal mine, right? And can you talk to me a little bit about abortion access conditions, what it's like in Texas, and what some of the broad landscape looks like around access to abortion in Texas?
As I listen to you and Sharon talk about this, it is clear to me I do live on a different planet. I mean, y'all are describing the way that abortion care is secure and accessible for women who live in Oregon, and in Texas, it is very, very different. And I just want to point out, I'm really happy to be here because I believe the Measure 106 that you're fighting is the first step that leads down a really bad public policy path. And I want to remind everyone, I don't know what people who are pushing for this are saying, but this is the first step. It's not like this would be the only thing that would happen. This would be the beginning of other steps. And when you take those steps together, this is what Texas looks like. There's a 24-hour waiting period to get an abortion. And that's whether you're paying cash yourself or your commercial insurance covering. The assumption there is you have not thought about this enough, and you're going to have to think about it again, even though we know that's not the truth. There's a bill that had been passed by the legislature years ago called the Woman's Right to Know. And the information therein must be shared with her. And it includes inaccurate information that I'm sure our physician on the panel is going to just gasp at, which is you have to tell women that the state of Texas believes there's a link between the abortion you're about to have and future breast cancer, even though there is no scientific, but the physician has to relay this. The visit before the abortion and the visit afterwards must be conducted by the same physician. Dr. Myron could not ask a nurse practitioner in her practice to say, well, she's coming for a 2-week follow-up. She'll be on your appointment schedule. Everything's probably in order. Please see this patient. No, it would have to be the same physician. No telemedicine can be used to assist with the provision of abortion care in any way.
Well, and just recalling in my own head, Texas is very big.
It is not small.
So that
we
seems
drive
like
long
a real
distances for lots of things.
Yeah. Yep. So in case I did not do this introduction, Jeffrey Hans is the CEO of Planned Parenthood South Texas. Would you like to share any additional information about the South Texas Planned Parenthood, about who you serve, and about what you do there?
Well, a little bit about the distance question. So Planned Parenthood South Texas has healthcare facilities in San Antonio Metro, which is where the organization's headquartered. But 2 of our health centers are in the Texas Rio Grande Valley, Cameron County, which is one of the most medically indigent places in the country, with an economic profile that is frightening, and that's in a state where Medicaid won't help cover people sufficiently. And so the distance between those 2 places, it's a 5-hour drive, and you still haven't left South Texas.
Right. So, Sharon, Oregon has long been known as a pro-choice state, right? I mean, we are one state that has no restrictions. There are restrictions, and we are the only state that has no restrictions. So this is an issue that Oregon voters have voted on 5 times, and they've defeated access, they've defeated restrictions to access to abortion 5 times because this is a state that trusts Oregon women and their families to make the decisions they need to make for themselves without interference from the government. So I'm curious about why you think this is coming up now.
Well, I think some of what the issue, you've stated just even in the question that this has come up already so many times in the past. It's not like they suddenly had the idea this is going to be, the time is ripe to just bring this up out of the blue. There is a long history. And to be clear, this particular ballot measure, it qualified for the ballot by the slimmest of margins, so 221 signatures. And the question is sort of maybe what got to that threshold so that they were able to overcome it. And I think it's a combination of some of their messaging and the misinformation and the fear tactics that they're using that maybe emboldened them and got them over the threshold after multiple failed attempts in the past. And also, to be clear, the group that got this onto the ballot, Oregon Life United, they see this as the first step, as Oregon's first pro-life measure. And it's really important to think of it in that context and what the motivation is behind that. But in terms of the fear and misinformation, one of the things that they talk about, and you see in the talking, here in the talking points, is women on OHP are going to seek abortions, even for healthy babies, into the 9th month of pregnancy. And that's simply not true. There is so much false and really scary information out there. Many of us in this room know that almost 90% of abortions do happen in the first trimester. When it goes into the second trimester or later, it's often due to heartbreaking circumstances relating to either the life or health of the mother or the fetus. And women don't make these decisions cavalierly, and having it portrayed as such, it does women an injustice, and it's fear-mongering. And you kind of see why they might feel emboldened, why the threshold might have been crossed now, because of the climate at the national level. So it's not surprising to me they could kind of eke over this time. But some of the other misinformation that they are setting forth also talks about things like mental health care, and says that women who have abortions are likely to have mental health issues later in life. And that's something that absolutely, I'm particularly passionate about, issues of mental health care. So I kind of looked into this. I did some research, and it's not true. Mental health issues relate to a number of biological and psychosocial factors that play into whether there's going to be a development of a mental health issue later in life. Decisions, any serious medical decision, including women's decision about whether to have an abortion, these are emotional decisions for sure. They entail a lot of thought, but it does not cause mental health.
The science tells us it does not cause. Study after study, right, has come out saying that there is no link or connection between breast cancer, between mental health issues, and abortion access, right? Yeah. Jeffrey, this is not the only fight that we're facing this year nationally. We've got a ballot measure in Alabama, and we've also got a ballot measure in West Virginia, and we obviously just had an incredibly public Supreme Court fight that, for those of us that are focused on reproductive health access, is really concerning. So I'm curious, what do you think is going on across the country, right? We talked a little bit about Oregon and about how this group has tried a number of times to get this across the line. They hadn't succeeded for years. Something did change in 2016, after 2016, and they were able to qualify at this time, again, by a very slim margin. But I'm curious about, what your thoughts are on these other 2 measures, on where we are in this moment around reproductive health rights and abortion access.
I think we all have to realize this is a coordinated strategy. This isn't something happening accidentally or randomly or, oh my goodness, what a coinky-dink. This is something where they need several different cases to percolate up through federal courts so that at this newly composed Supreme Court, which they got very interested in this in November of 2016, that there would be a number of cases that this newly composed court could select from. The way the Supreme Court works, they hear the cases that they select. It's not like, they sit down and write something up on their own. And so what the grassroots of the abortion opposition movement needed to do was to find a way that we need a few different laws in some different places that they know will be challenged, that will then have federal suits, that will then get appealed so that the court can select a case that will have the potential to unsettle that 1973 settled law.
And I just wanted to also, it's just so, it is really scary.
It's insidious.
But just in talking about the messaging, and that's something else that's been kind of insidious that we see. I think the groups that are doing this are really getting more politically savvy and able to sort of take some of the language from the choice movement and adapt it for their own purposes. So we're now seeing them kind of talk about choice, it's your choice where your tax money goes. It's your choice about that. And so looking at the messaging is really interesting as well.
I'm going to come back to that. You were just reading my mind. If you are just tuning in on the radio or online on KGW or Open Signal or X-Ray, this is the City Club's Friday Forum. My name is Kalpana Krishnamurthi, and I'm the program director at Forward Together and part of the No Cuts to Care, No on 106 campaign. Today we're hearing from Multnomah County Commissioner and Emergency Room Physician Sharon Myron and Planned Parenthood South Texas CEO Jeffrey Hans. So I've been in like 4 editorial board meetings with the proponents of 106, and I'm really excited to share, of course, with the City Club listenership that we have received at the No Cuts to Care 14 editorial board endorsements endorsing a no vote. And one of the things that the proponents are very clear to talk about is they keep talking about it this way. They'll say things like, well, this isn't banning abortion, it's just giving Oregon voters a choice in where their taxes go. I'm just curious, as a Multnomah County Commissioner, if maybe you have some thoughts on taxes and how our taxes work.
I have a lot of thoughts on taxes, a lot of the time. But my first response is that shows a very basic misunderstanding of how our tax system works. How taxes work is that we all pay into a system that we rely on to make the choices for the greater good and to benefit our society. As a Multnomah County Commissioner, I take my responsibility to do that very seriously, to decide where we use our limited resources to most effectively help the most people. And that's what we need to be doing. I don't get to, I'm going to put on my hat as just a regular person. It'd be great if it was the case I get my taxes and in filling out my return, I get to go through my checklist and say, oh, here's the things I agree with. I'm going to pay for that and I'm not going to pay for these other things. Or it's a little selection process. And it can't nor should it be that sort of a system. For example, I may not agree with smoking. I think it's very bad for your health. It can lead to expensive and dire consequences for people who smoke. But our taxes go to paying for, lung cancer treatment and other repercussions of smoking. And I expect that and I agree with that. It's the greater societal benefit, especially for healthcare.
So, Jeffrey, in Oregon, we've never seen the kind of mass facility shutdown that we saw in Texas. after the 2013 passage of HB 2. And for our listeners, HB 2 required doctors who provide abortion to have hospital admitting privileges. It required abortion clinics to upgrade their physical locations to be ambulatory surgical centers, and it prohibited abortion after 20 weeks except in very limited cases. Between HB 2 and an earlier law requiring ultrasounds, women seeking abortion care were required to have 4 visits with a healthcare provider. There was a lawsuit filed against HB 2 that did go all the way to the Supreme Court and was, in that case, the HB 2 was overturned in 2016. But I'd really like for you to talk about what happened in Texas between 2013 and 2016.
Things changed. And that Supreme Court case, it's Whole Women's Health versus Hellerstedt. If you wanted to Google it up and shorten my mind, it's just Women versus Hell. But things changed. And I think that it would be silly for anyone to say, oh, well, that would only happen in Texas. It happens when you have places that adopt these public policies, and it just so happens a lot of those policies have been adopted in Texas. The number of facilities providing abortion in Texas in 2013, there were 41 different places, and that's almost half of what it was 10 years before. By 2016, that had dropped to only 17 locations for a state that's as big as what we were talking about, a little while ago. And then the other thing that I think should be really disturbing for people, and it goes to this taxes thing, which is just such a spurious argument on this. If you go from 2010 to 2015 in Texas, the number of abortions fell dramatically. It fell by 29%. That's almost a third. And so when and just for those who want numbers on this, it's about a little more than 22,000 fewer abortions. Now, these tax people who are talking about money and everything, what they need to figure out is what's going to be the average cost associated with 22,000 people who did not get the abortion that they were seeking and wanted. And to say that there are no taxpayer-funded healthcare costs for those 22,300 women, well, that's just silly, and it doesn't stand up to math.
I think it's so interesting when we're the folks that also fight to make sure that every low-income family has the resources that it needs, right? So we are also the folks that make sure that we've got health insurance, that children's programs exist for preschool, that we are resourcing families to have food benefits. So the idea that folks in the reproductive health rights and justice movement are somehow anti-child feels ridiculous because, this is not
Because it is ridiculous.
Right? And because we see whole families every day, right? And we know that our families are connected and every family needs and has the right to resources. One of the ways that abortion stigma works is we don't actually hear the stories of people who have had abortions. And I'm going to come back to asking both of you why you think that stigma exists. But I'd like to turn the mic over to Megan, who is sharing her abortion story with us.
Thank you. Hello, my name is Megan. I'm a mother of 2 and a social worker. I was raised in a pro-choice Oregon household that always trusted and respected women to make their own decisions about their bodies. While I've always been pro-choice, I never thought I'd be in a position where I would need to have an abortion. I was always very careful, and even as a teen advocated for access to contraception for myself and my peers. Then I grew up, I got married, and I had 2 sons. My marriage was toxic, and the relationship was very dangerous for me. It takes an average of 7 times for women to leave an abusive relationship. After my first attempt at leaving, I returned to the relationship, only to discover shortly thereafter that I was pregnant. During my first 2 pregnancies, I was overjoyed and so ready to be a mother. When I discovered that I was pregnant a 3rd time, my heart sank. I absolutely knew that I could not take care of another child, not just for my own sake, but for the safety and well-being of my 2 boys. I knew without question that the right thing and the only thing to do was to terminate my pregnancy. At the time, we were struggling as a family to make ends meet, but I didn't have to worry about whether or not I would be able to afford my abortion care. I remember feeling so relieved that I didn't have to worry about how I was going to pay for my abortion while I was in that difficult situation. I'm so grateful that when I needed that medical care, I was able to access it without having to consider whether or not my income or my health insurance qualified me for those health services to be covered. This is why I was so horrified to see Measure 106 on this year's ballot. It targets the healthcare and rights of the most vulnerable among us, those for which options are limited and the stakes are so high. Making the decision to terminate that pregnancy ended up being a turning point in my life. I was at the lowest I had been in a long time, but when I made the decision to have an abortion, I knew I needed to take control of my life and take care of myself and my kids. I started applying to jobs. I picked up some part-time work and built that into a career. I started to reclaim and grow my self-esteem, confidence, and the financial security necessary to finally leave my ex. I am safe now. My boys are safe now. I have a career with good benefits that allows me to provide for my children, even if it is still tight sometimes. I work hard and I've overcome so much, but guess what? Even with as far as I've come, because of who I work for, Measure 106 would still take away my ability to choose what would be best for me and my family. What I've experienced is why I'm here telling my story. It's also why I've been canvassing against this measure, and I'm urging all Oregonians to vote no on Measure 106.
Thank you so much, Megan, for sharing your story. Megan's story brings into the center a lot of what we know is true about abortion, right? That the vast majority of people who have an abortion already are parents, that people have abortions for many different kinds of reasons, right? That abortions are a part of healthcare, right? But can often be a turning point for someone to be able to make the decisions in their life that allow them to move forward. So I'm curious about what it is that you see, Jeffrey, in your clinic when women are making this decision, and how you share that with folks that don't hear those stories. Because again, the way that this is seen as a private decision, it's seen as a decision that happens between doctors, the families, and the woman having the procedure. And because of that, there's a lack of public narrative about why people have abortions or how people feel about their abortion. And I'm just curious about, when you are at the cocktail party and are like, this is what I do for a living, what kind of stories do you share with people to really help them understand, like Megan's story, that this is a normal part of healthcare and a normal part of women's lives? If 1 in 4 women have an abortion, you know someone that had one.
Well, then there's someone standing there in that group at the cocktail party who has had an abortion, whether she says so or not. And so I think we have to just applaud the courageous bearing of witness that Megan brings to this. And, Planned Parenthood has had the honor and the humbling experience of hearing women's stories for, a century nationwide and 80 years in South Texas. It leads you to only one policy position, which is you just have to trust women. If you hear their stories and understand their lives and the choices they have made around reproductive self-determination, you have to trust them. And I think that women find it, and it's hard to say, I think that women, because I'm the one on the stage that is not a woman, but I think every time one of these Measure 106 kinds of things happens, and all the other crap that I've seen happen in Texas, the not-so-subtle message, whether these measures fail or pass, is that the women who watch the news on this, I would speculate, there are a lot of women who say, after one of these measures is covered in the news, I'm so glad I've never told anybody at work that I had an abortion, because I'm sure there's some of the people at work who voted differently than I did, and I just don't want to be treated differently because of this. And so it ghettoizes this part of healthcare that is so essential and vital to women's autonomy and futures, and it leaves people feeling disempowered, and we've just got to reject that framework.
I just want to say, you spoke very well for women in that.
Thank you very much. You're welcome.
So, Throughout this campaign, we've been asked what would happen if Measure 106 did pass, and we've been clear that we know that women would still seek abortion care. And as an ER physician, Sharon, I'm curious about what concerns you have about women's health and safety if abortion access was restricted in this way in our state, which we again know is the first step that the proponents of Measure 106 want to take.
Yeah, no, I am extremely concerned about that. I think that could have a truly devastating impact on women, and it's a little akin to what I saw when I was working in the emergency department before the Affordable Care Act, before we had Medicaid expansion and were able to have health care for so many people. You would see people coming in at late stages of disease. You would see them coming in crisis. You would see people just traumatized by the health, whatever experience that they had, and come in at a point where it's either you can't treat what they have, you can't manage what they have, it's dangerous to treat, and I think that's what we would be seeing here. Any delay in care for any medical condition increases the risks, increases the danger, increases the trauma experienced by the person who is having a procedure, is having whatever medical treatment that they need. And so that's a danger that I've seen in other contexts that I know Jeffrey would definitely be able to speak to in terms of what he sees. It's that slippery slope. So the delay is one danger in and of itself while women try to muster up the resources to have an abortion. But it also, in the real world, would lead to a denial of abortion access for many women, and that in and of itself has really significant consequences as well. I mean, it can lead to, unwanted pregnancy, can lead to women falling into poverty if they're living, especially living paycheck to paycheck, lead to intergenerational cycles of poverty. And this also can lead to, if there are measures such as this, and women are desperate, it can lead to women taking the situation into their own hands and trying other means other than the healthcare system to access abortion, which can be extremely dangerous.
Jeffrey, I'd like you to weigh in on this one too. Often reproductive health advocates are accused of being hyperbolic about what happens if we restrict access to abortion care, that we're accused of kind of raising the specter of back alley abortions and, images of coat hangers or other, we're seen as being, that's not how it would look, right? And I'm just curious about what you've seen in Texas with increased restrictions in place and what it looks like when we restrict access as hard as Texas has. What are the choices, options, and how are communities and families dealing with this lived reality of limited access to safe abortion care, but still making the decisions that they need to make for their own family?
Sharon's last point about self-induced abortion, that's not a small matter. And the UT's Texas Public Evaluation Project on this found that women who experience access to abortion care are significantly more likely to seek out self-induction in some way, form, or another. And I'll put a finer point on it with a story from our clinic in Brownsville, Texas, which is literally the tip of Texas. We had a client years ago who came in, walked in with her boyfriend. She said she wanted a pregnancy test. And all this happened in Spanish, so it was our staff who was relaying the story to me, and I was not there when this happened. But the way she asked it, she needed a pregnancy test to see if she was still pregnant. And she used whatever the equivalent of being still pregnant. And so when she came back with a urine sample, it was not yellow. the urine itself, the sample in the cup. And the blood was obvious, and she was told, you need, it doesn't matter whether or not you're still pregnant, you need to get to an emergency room because you need to find out what happened. What happened? And she goes, well, I went across the border and I did something, and I just need to know if I'm still pregnant. And, you know, it's like, well, that's one story, that's one woman. Well, that's on the edge of this nation geographically. We have got to stop acting like this is one woman, one place, over there. This is real, and that's what happens.
Thank you. I want to hear from a local Portland OBGYN who is an abortion provider in our state. Dr. Rachel Pilliod, I'd love for you to share your story as a provider here in Oregon and someone who has made the choice to provide abortion care as a part of your practice, and what that has been like.
Thank you. I'm here today in opposition of Measure 106. For the past 7 years, I've worked as a physician caring for women during their reproductive years. I've diagnosed pregnancies that occur because they are highly desired and long sought after, because of contraceptive failure, because of partner violence and coercion, and because it's not always possible to determine when you're fertile, to be perfectly honest. I care for women and their families when pregnancies are desired and when they are not desired. I care for women when I make a diagnosis of a healthy, uncomplicated pregnancy, and when I find out that there is something genetically or structurally wrong with the fetus. Though rare, I have told women and their loved ones that if their pregnancy continues, it will likely end in catastrophic harm to the mother. I meet with women after their pregnancy ends, regardless of the outcome and the circumstances, and I help them navigate any possible future pregnancies. It's a privilege, and it's a huge responsibility, and one that I do not take lightly. Recommendations that I make and decisions that women make are made with real financial and personal consequences. I've learned that what women decide in terms of continuing or ending their pregnancies is deeply personal, and it is not a decision that I can ever predict, truly. Even under the most dire circumstances, I cannot predict what women are going to do. It doesn't divide neatly by party lines, by religious affiliation, by pregnancy history, or severity of their health consequences. It truly doesn't. Unfortunately, if this measure passes, it will create a dangerous divide by payer and ability to finance the procedure. For many of my patients, it will cause harmful delays, while women secure funds or find lower cost services, making the procedure ultimately more complicated and with additional risks for these women. It interferes with the ability women have to make personal decisions that are in their best interests, and it restricts my ability to provide unbiased counseling to women if one option is not possible given a limitation of funds or access. It is harmful to women, healthcare providers, and I'm grateful for the work of the City Club, the members of the panel, and I hope that everyone in Oregon gets out to vote. It's not enough just to Facebook like the No on 106 campaign. You have to get out and vote on Election Day.
Thank you, Dr. Pilliod, for also reminding us that it is women of all kinds that seek abortions, right? Sometimes there's a narrative about who it is that seeks abortions, and we know that women across all ages, across all parties, across all races seek abortion care because abortion care is a part of health care. If you were just tuning in on the radio or online with KGW, Open Signal, or X-Ray, this is City Club's Friday Forum. I'm Kalpana Krishnamurthi, the program director at Forward Together and part of the No Cuts to Care, No on 106 campaign. Today we're hearing from Multnomah County Commissioner and Emergency Room Physician Sharon Myron and Planned Parenthood South Texas CEO Jeffrey Hans. We are ready to go to questions from the audience. So you do have note cards on your tables where you can write a question down. And I think the mic is also potentially open for folks as well, but please bring your questions, hold your hand up, and we'll get some questions going. While we're doing that, Jeffrey, I'm curious, I went to college in the 1990s, and so I saw what happened at clinics across the country and what happened in the clinic in my college town, which was enormous protest lines, barriers, barricades that had to be put up that created almost a gauntlet for doctors, clinicians, patients, their families to go through to get to the clinic building, right? And I'm curious about kind of where we are around that kind of open protest at clinic sites, and whether that's something that you're seeing, or Dr. Myron, your sense of this as well. Has the atmosphere around clinics shifted, or does it still feel like we're navigating that kind of gauntlet to get into services?
We have to thank President Bill Clinton and the Congress at the time for passing the Freedom of Access to Clinic Entrances, which created federal criminal penalties for some of the activities that you were accurately describing. And so I think that helped. And then I think that we have to realize that every abortion providing organization, whether it's a private physician's office or a Planned Parenthood organization, we are spending money to make things safe. Money that it is the correct thing to do, but we have to remember every time we do that, it's a theft from resources that could go to healthcare. And then the last thing I'll say is I feel his election 2 years ago has put some wind in the sails of people feeling bolder about lots of kinds of ugliness in this country. And that frightens me, and I think a better person would call that out as wrong.
We've got someone at the mic with a question or comment.
Win Wakala, City Club member. Jeffrey, with you coming from Texas, what are you hoping for the future? What are your plans? How are you helping to get things right again?
I had a very important conversation with a supporter a few years ago when things started getting really difficult, and the way he described it was all life is about evolution and making it through difficult times, and that the organizations that will evolve and adapt in the future to the new environment are the ones that survive the Ice Age. And he told me, he goes, your job is to keep as many clinics open, keep as many women served, and be around to adapt to the new and better world. I think that existence, survival, bearing witness to the good healthcare that we provide, and being here for the future is top of line, and I look at sustainability and viability on a daily basis to ensure we're going to be here. Planned Parenthood South Texas will celebrate its 80th anniversary next year, and we have a long future ahead of us.
I've got some great questions from the audience, but we also have one more question at the mic, so we'll take that one first.
Yes, Jeff McCarthy, a City Club member. I'm a family physician. I've, in the past, had to counsel women, young women, about abortion, and I've done that sympathetically, and where they went away thinking I was at least on their side and neutral in this issue. I have a comment on the role of Planned Parenthood, and then I have a question or statement for you. In my view, Planned Parenthood has three missions. One is highly moral, one is amoral, and one is highly immoral. What's the moral mission? Providing cancer screenings for women. What's the amoral mission? Planning childhood, planning pregnancy. You already know what I think the immoral mission is. So my question for Planned Parenthood is, why are you not focusing, and here's a data point for you. When I worked in a free clinic in this city, I could not refer women with no insurance to Planned Parenthood for pap smears and mammograms. They had to have insurance. Look on your website, you'll find the data point there. So I was really disappointed that any woman in this city could not depend on Planned Parenthood for a mammogram or pap smear. So my suggestion to you is you take all this organizational energy that you got focused against the right wing, against abortion, and make it your goal that no woman in this city goes without a pap smear or mammogram. That's my challenge for you. Now, here's a statement. You obviously know what my viewpoint on this issue is already, so I am not remotely surprised that you have not. Let me see
if there's actually a question here, because this is two statements. Do you actually have a question?
I was halfway through it. My question is, why do you not have any sympathy, understanding, or respect for the opposite viewpoint?
We're done. Thank you. So there's a lot there. And I'm curious because we hear Planned Parenthood used as kind of a battering ram, right, in this conversation with both misinformation and critique of the work that Planned Parenthood does. And I'd like to give you some room to respond.
I just don't accept a lot of what was embedded in the comments and the questions, and I'm not going to waste the City Club's time. I lead Planned Parenthood South Texas, so I won't speak about the Planned Parenthood operation here in Portland other than my deep admiration for the colleagues I've met here and at the Planned Parenthood in Eugene. And so I have every confidence that they too would reject the assumptions that were just built into the loaded statement. And I would just close with every healthcare visit at Planned Parenthood is filled with goodness and morality.
So we have a couple questions here, and I want to start with this one. So abortion access is a place where we have strong support from women of all backgrounds. White women, black women, Asian women, Latinx women, all have really strong support for abortion access. In Oregon, the No on 106 campaign is working with organizations of color across the state, and even icons like Dolores Huerta, to defeat Measure 106 and to show and express the support of communities of color. Yet there's still a perception that communities of color are less supportive about abortion access. Why do you think that stereotype persists?
All I can say is I've lived my entire life in a city where white people are the statistical minority. My entire life has been spent growing up sharing friendships, love, and family with Mexican American people. When I look to the women and the men who work with me at Planned Parenthood in South Texas, they're overwhelmingly people of color. But that's a reflection of the city that I'm in. I think the people who try to push forward an idea that there is not support from communities of color, I just have to question and I don't want to cast a challenge, but I just wonder if that's just a fair starting point and what other racially charged foundation there might be inside of that.
Mm-hmm. Yeah, it's been really interesting to, the organization I work with has been knocking on doors in communities of color across Portland, in North and Northeast Portland, and we've been asking people, how do you feel about access to abortion? Where would you put yourself on the spectrum of 1 to 5 around access? Do you think this is a decision? And then having a conversation about the values that people have and about their experiences and what brings them to it. And we've heard a range, right? It goes down to some folks saying, this is something that I believe in because it's a fundamental to a woman's access. We've had people say, I would never make this decision for myself, but I understand I'm not in another person's shoes. And I think part of the reason that the myth of kind of communities of color being anti-access to abortion is really a stereotype that hangs over us that's built in some very racist assumptions, right? And In truth, I think communities that have experienced multiple structural barriers to accessing healthcare, to economic justice in our country, actually live at the cross-section of those issues every day. And so they know fundamentally, in an extremely lived, powerful experience way, what it means not to have the ability to make decisions for your own family, not to have sovereignty over your own family, not to have the ability to make the decision that you and your family need to make. And so, in my experience, communities of color are more pro-choice than white communities, precisely because of those reasons, because we know what it's been like to live without the kinds of access to the structures and supports that our families and communities have needed. And we see this as one more attack, one more attempt to tell us where we belong and where we fit, and we're going to reject it.
I just want to add one quick thing, and I could not agree. I could not agree more with everything you said. And I think talking about, sometimes when you talk about the faith community as well, there are some assumptions that are made there that if you're of a faith community, of whatever faith it is, that you are against abortion. And that's another false assumption. I know there was an interfaith prayer breakfast recently where a number of different representatives from faith communities got together and had the conversation, and their point is that it is their faith actually that makes them pro-choice. They're pro-choice because of their faith. It's a social justice issue. It's not despite their faith.
Thank you. So we are at our closing, and so I guess I want to ask each of you to consider kind of making a closing statement and letting City Club viewers, City Club listeners and folks in the room here today, leaving them with one thought about the Measure 106 campaign, about why the City Club itself endorsed No on 106, and just give you 30 seconds to make a final comment.
Do you want to?
So I guess I can start. That took however many seconds. I guess the bottom line for me is I am a physician, and I care about women's health care. I care about access to the full spectrum of reproductive health options. I care deeply about social justice. And to me, what Measure 106 does is blatantly against all those things based on a narrative of fear, of misinformation, and I stand against that as a physician, as a person, as a county commissioner.
I hold and cherish those same feelings and values, and I would say to the undecided voter out there who maybe doesn't feel as passionately about this, then just focus on the money. Measure 106 isn't going to save one nickel of tax dollars for Oregon.
Thank you.
And with that, our time is up, and we need to pause the discussion for now. We are adjourned for the day, but please join me in thanking Sam Metz and Nikki Novak for producing today's program, along with our wonderful panelists for sharing their insights.